speaking on the territory of the signatories of Treaty 7, and I acknowledge the Métis people who share a deep connection with this land. Just a few days ago, Adriana LaGrange finally put a stop to the UCP's catastrophic privatization of lab services. After the UCP tore down the public system that was built under the NDP, Albertans were faced with unacceptable delays to getting a booking, huge delays even when you had an appointment, frequent cancellations, and most worrying, an alarming rise in mistakes. That was privatization and a chaotic transition which was imposed by the UCP. But even now, as they pull lab services back into public health care, the UCP's sheer incompetence is fully on display. Let me talk a little bit about how our labs work. The most common types of lab work are chemistry, hematology, which is largely about blood cells, immunology, microbiology, and pathology. Lab physicians and clinical scientists oversee the processes that assure high-quality lab tests, and they're often responsible for interpreting the tests. For example, they interpret all biopsies. This is an absolutely critical role because so many treatment decisions are based on these results. These decisions will have big consequences for patients. So the doctors that do the work are right at the heart of a functioning healthcare system. But here in Alberta, all of those doctors who have been working for Dynalife lost their jobs on Thursday at midnight when Dynalife closed its doors for good. The obvious thing for the government to do would be to offer these doctors identical contracts to what they were working under at the time to move them seamlessly over to the new system. But this UCP government, in its incompetence, is trying to force these doctors to immediately sign new inferior contracts. They don't have any limitations on their workload, and they don't have any provisions for extra pay for extra work. Note that the lab physicians working for Alberta Precision Labs, which is a subsidiary of AHS, have been working under these inferior contracts, which expired 5 years ago, and which the government has been delayed in renegotiating. Not surprisingly, an overwhelming majority of the lab doctors from Dynalife are refusing to sign these new contracts. So here we are, heading into respiratory illness season, and the doctors that we need to guide almost the entire system have no contract and no employer. We're all just hoping that everyone keeps working and somehow gets paid. But as of right now, there are no guarantees of that. And note that the lab physicians who now work for APL are already working without a contract. This is not a situation that promotes retention and certainly does not encourage recruitment to Alberta. Let me be clear, if we don't have these physicians on the job, we don't have a healthcare system. At a time when we are desperate for stability, Adriana LaGrange is picking yet another fight with yet another group of healthcare workers for no good reason. And yet again, it will be Albertans, Alberta patients, that will suffer as a result. The solution to this is simple. Offer these doctors to continue with the same deal they've already been working under. This is just common sense. Now I'm happy to take your questions.
All right, thank you, Dr. Metz. First, we'll check if there's any questions in the room.
Yeah, hi there, Nick with City News. A quick question. So I think just for clarification, explain a little bit about what had happened when it switched over to Dynalife, what kind of contract were they offered, and what the situation is right now by going back to the AHS, because it is a very kind of confusing situation, trying to go back to what sounds like, I think you said, was there wasn't a contract with AHS when they moved over to Dynalife anyway, so right now they're this kind of limbo. So if you could kind of clarify that again, and then maybe what should need to happen here in the next few months before we get into, like you said, this respiratory kind of illness season.
It is confusing. So in Alberta, we have lab physicians in northern Alberta that have been working for Dynalife for a number of years, and that stayed the same until, I guess, midnight on the 31st of August. Then we have the physicians that work for APL, and they have never switched over to Dynalife at this point in time. There was meant to be a transition, part of it happening in June, where pathology would be switched, but we knew the system wasn't working, or HS knew the system wasn't working. That was delayed and then delayed. So we have two groups, those under contract to APL and those now under no contract.
Sorry, just a quick follow-up again. So going into the next few months here, I mean, what needs to be done? What is the most urgent thing that needs to be done to make sure that we're not in a position where, like you mentioned, Alberta patients perhaps might be pushed to the wayside because there won't be anybody there to treat them?
So our problem is that there's about 80 physicians in that work for Dynalife that now have no contract. So if you were to go in and have surgery to remove a breast lump, let's say, that pathology would be going to a Dynalife lab physician, pathologist, but they're not under contract anymore. So we have to hope that they are going to still be there reading that pathology and interpreting those results. So what needs to be done? We need to say, continue. We will continue your contract until we work out at the negotiating table a new contract for all of the physicians, APL and the new physicians coming from Dynalife. We need to continue it and promise them they can continue under the previous contract.
Anything further in person?
One last one, and I apologize, sorry. Minister Horner spoke to the media about a week ago on the fiscal results. He was questioned about Dynalife and the fiasco that happened, and it may be perhaps how much that was going to cost Albertans to do, yet again, switching back over to the AHS. He, at the time, neglected to say anything as he didn't have the numbers in front of him. Has the NDP looked into that, or is there any kind of prediction of what this might cost Alberta?
Well, we have called for the Auditor General to do a review of this because we don't have access to any of those numbers. And I'm sure they're not known just yet because a lot of the costs will need to come to support the transition.
Right now, we'll go to questions on the phones. Just a reminder, if you're joining by phone, to use *9, and if you're joining by Zoom, to use the raise hand function to get into the question queue. Our first question comes from Catherine Rogowski from Alberta Today. Go ahead, Catherine, your line is open.
Thanks for taking my question. So the minister's office sent something to us. They said that Dynalife physicians who hold a community medical lab services contract were given an offer, and they have until September 25th to review it and sign it. And they said, regardless of whether Dynalife physicians sign this contract, Alberta Precision Labs is going to be compensating them for any work that they perform between September 1st and September 25th. So what would be the issue with that? They're getting compensated regardless.
So the offer that they've been given is this inferior contract that is now in place for APL, which expired 5 years ago. That is the contract, and we know that the majority of the physicians have refused to sign it. It's unclear to me whether the way they're going to be compensated is under that contract that they're not signing or the one that they currently have with DynaLife. I don't believe the physicians are clear, and we need clarification because we've been told that they have an assumed contract without signing it.
Do you have a follow-up, Catherine?
Yeah, and so that master agreement that you mentioned, that 5-year one, it's still in effect. So when you say it's inferior, are you hoping that the APL physicians get the same deal that the DynaLife physicians had, or what are you hoping to see come out of this renegotiated master agreement?
Yeah, the contract that is agreed to will be done at the negotiating table. That's not for me to comment on, but it is a 5-year-old contract that has continued, but the physicians working for APL have been very dissatisfied with that. They are not covered under the master agreement between Alberta Health and the AMA that other physicians are covered under, and they have not been successful in getting negotiated up to this date. 5 years it has not been renegotiated. They've been pushing.
Anything further, Catherine?
On a different topic, there's this E. coli outbreak at daycare centers, and I was wondering what, if anything, you wanted to see happen, come out of that. Do you want an investigation? What should happen?
Well, I think it's a sign that we need to have a medical officer of health in this province. At this point in time, we have a physician who is an infectious disease physician, but a physician who is trained as a medical officer of health covers a lot more than infectious diseases. And while this particular outbreak is an infection, we have a major challenge that we do not have a medical officer of health. And within the department, there are more vacancies than the main medical officer of health. And I know that there has been a search agency trying to find people, but no one will even apply for the job in Alberta, which speaks to the problem of government interference in the role of the medical officer of health. So we are at risk in every way by not having someone in that position involved in outbreaks such as the E. coli.
We'll do another pass for questions on the phone. Just a reminder, star 9 on the phone and raise hand on Zoom. And one last pass for questions in person. And with no further questions, we'll wrap today. Thanks, folks.
Thank you very much.